Well, May is Stroke Awareness Month. It's something that can happen to anyone, and it's a leading cause of death.
Which is why it's important to know the warning signs. And here with more on that and what a patient experiences when taken to the hospital is 10 on Your Side's Ashley Knight.
Well, Aisha, the acronym for stroke awareness is Be Fast. You need to be aware of any changes with a person's balance, eye gaze, or eye movement, their face, arms, or speech, then time is of the essence. When you think someone might be having a stroke, the first thing an EMS team will ask is when were they last seen acting normal?
If it has been less than 24 hours since their last known normal time, we will hurry up and try to get them to a comprehensive stroke center like here at Riverside, because they are very well equipped in being able to reverse some of that damage.
In the ambulance, crews determine the severity of the stroke, run simple tests, and treat any other symptoms like pain or nausea. They'll also start an IV if one is needed and continue it as the patient is brought into the emergency room.
They'll come in through the EMS doors and they'll bypass any of the other rooms and they'll come right down this hallway. And then they'll end up in our CT stroke holding area.
There, a multitude of physicians and staff run more tests and assess the patient.
The ER physician or ER resident will then do a quick neuro evaluation just to see where we are on our stroke scale, how acute and how devastating the stroke is. This is where the nurses will put an IV in. We'll get a quick sample of blood to check some electrolytes.
If the stroke has done damage, there is the possibility of reversing it if the stroke happened within the last 4 hours.
We have a clot busting medication that we can give them that can help stop the stroke from damaging more brain tissue and allow for a quicker recovery and hopefully some better neurological outcomes.
The patient is moved quickly to the CAT scan machine, and after evaluation and treatment, doctors talk to you about why you had the stroke and about preventing the next one.
You give them a tailored plan to kind of reduce those risk factors in the future, because we don't want them to have to come back to us. We love our patients, but we want them not to have a stroke again.
And if you're not sure they're suffering a stroke, better safe than sorry.
We would much rather see them and be able to intervene quickly. Even if it's not a stroke, it could be something else that we can help with.
We have more information on strokes and how to prevent them over at wavy.com. Ashley Knight, 10 on Your Side.